Food for thought. We will be focusing on the risk assessment and prevention of pressure ulcers specific to feet. Who is at risk of developing a pressure ulcer on their feet? It is important not to assume that because the feet appear normal, that there is no risk of pressure damage. The risk may not be visual. Through completion of a formal pressure ulcer risk assessment, along with clinical judgment, staff should be able to identify relevant risk factors. These may include, for example, patients with known peripheral vascular disease, neuropathy, diabetes, immobility, or any current or previous damage to their feet. CPR for feet is a national podiatry initiative which encourages staff to think about the risk to patients' feet when completing the initial risk assessment. CPR stands for check, protect and refer. Check your patient's feet and identify any risks or issues. Protect, apply foot protection where there is an identified risk or issue, and refer to podiatry if and when indicated to do so. How many times have you come across a situation like this? Patients often slide down the bed, resulting in their feet pressing against the end of the bed. This can result in pressure to their feet and the potential for damage to occur. Other things to consider are items hung over the end of the bed, for example, clipboards, mattress consoles, and alcohol gel holders. These can result in device-related pressure damage also. Please remove these if possible, and consider extending the end of the bed to provide extra foot space if required. Sole-Safe Bed End Pressure Relief Pad is a product which could be considered in these circumstances. It helps to provide pressure redistribution to the soles of the feet. Other factors to consider are shear and friction. These are forces which can be exerted on the patient's skin and can occur from repeated movement of the feet, in particular the heels against a surface, such as a bed, a footstool, or the patient's own footwear. To prevent this, it is important to correctly use sliding sheets when moving or repositioning patients in bed. More than one sliding sheet may be required to ensure the sheet is under the full surface of the patient, including their heels. Profiling beds can be useful to assist in repositioning patients. However, if used incorrectly, they can still cause shear and friction to the patient's skin. In order to minimise shear and friction, alternate small movements between the head and the knee break sections are advised. Patients at risk, i.e. with a Waterlow pressure ulcer risk assessment above 10, require to have their skin assessed on a regular basis and have a plan in place to prevent pressure damage. Skin inspection should be carried out and documented, and any new findings acted upon as soon as possible. Please see head to toe skin inspection video on Athena site for full explanation on how to carry out a skin inspection. Where skin damage is found but not broken, for example, a grade 1 pressure ulcer or suspected deep tissue injury, leave the area exposed so it can be easily monitored and use appropriate foot protection. Dressings should only be used where skin is broken and required, as these do not provide adequate pressure relief. Please remember to remove TED stockings regularly to allow for feet to be examined. Where skin cannot be examined regularly, for example under casts or bandages, listen to your patients. Are they complaining of pain, burning, or altered sensation to their feet or toes? If so, you need to act further. Decisions on appropriate foot protection for patients will be based on clinical condition, risk factors, and condition of their skin. Remember, a pressure redistributing mattress alone may or may not protect heels, and additional offloading may be required. Options for offloading include boots or elevation with a pillow. The aim with a pillow is to ensure the heels are floating and free from the surface on which they are on. The pillow should be positioned under the full length of the calf for maximum support, with the heels hanging over the edge. Ensure heels remain floating and are not touching the surface. Remember, pillows can flatten out through time. Offloading boots provide complete protection and pressure relief for the heels. Examples of these are PREVENTABLE foot safe boots. These come in various sizes. Choice is dependent on the patient's shoe size, and posters are available to aid in this selection. This product straps on with buttons to hold the product in place to aid retention and minimise movement. By observing the heel, you will see if it is supported off the surface and floating. If it is not, the boot may be too big for the patient and a smaller size indicated. Also repose boots, which currently are a standard one size fits all. Both of these products are fully washable as per infection control guidelines and can be reused between patients as long as the product is not soiled. Remember, pillowcases should not be applied over these products. They can wrinkle and cause ridging and can prevent effective offloading from the heels. Boots should be removed regularly to examine the skin and also when the patient is mobilising. If the patient is mobile, restless, or does not tolerate boots or pillows, heel-safe pressure relief pad can be considered for use. This product will not offload the heels, but will aid with pressure redistribution. If the patient is already on a pressure redistributing mattress, this product should not be used as it will not provide any further benefit. All equipment is available through stores, and individual areas are responsible for ordering their own stock. We all play a part in preventing pressure damage to heels. By following the guidance in this video, hopefully this kind of injury can be prevented. For further information or guidance, please see Athena or contact the Tissue Viability team.